Namaste to all of you, dear friends. Today I'm going to talk about angina pectoris. Angina pectoris is a condition in which patient feels pain, severe pain, acute pain, pressure pain in the left side of the chest, near heart, pain what radiates towards your jaw, neck, and left arm. So that we call angina pectoris. To understand angina pectoris, you see that every organ, every cell, every muscle in our body that functions because of the oxygen. He needs oxygenated blood with all the nutrients. So our heart function is to give that oxygenated blood to each and every cell in the body. But like other organs, heart itself is also working 24/7. He needs also oxygen. So heart has got its own circulation system, and that is through coronary arteries. Coronary arteries give oxygenated, pure, nutritional blood to heart, then heart can function optimal. So one way or other, by some reason, if coronary artery is blocked, if it can't give enough oxygenated blood with all the nutrition to the heart, then heart can't pump, heart can't function. Then angina pectoris or pain in the left side of the chest near heart can be felt, and we call that angina pectoris. If you take rest at that time and you don't do anything, most of the time it's over. You see, if we are doing more physical job than we are used to, or we are doing physical exercise, or we are climbing the stairs, we are climbing the mountain, if there is more workload, so more workout you have done in the sports school, you feel that there is more heartbeat. Because every activity, whatsoever we do, that is being supported by the oxygen supplied by the heart. If you do more physical job, heart has to work more to give more oxygenated blood. And if it can't meet the need of the body, in that case, it is angina. So supply is little less than the demand of the oxygen is in fact angina. So we see in the practice you have got different type of patients with this type of pain, this type of characteristic pain. First one is very common, we call that stable type of angina. That is effort-induced angina. Effort-induced angina means when they do physically more than if they have done extra today, if they have lifted heavy things, if they have done extra sport, then more oxygen is needed, and most of the time, if we take rest, it's over. So then there can be emotional condition. In emotional condition, we need more oxygen because sympathetic activity starts and we need to run away. We need more oxygen in that case. So that's why when people are emotional, then they can get also pain in the chest. Then we have got other type of angina, we call that unstable. Unstable, that is that frequency is getting more, severity is getting more. Patient doesn't get relief with just taking rest. So its intensity and its severity is more than the effort-induced angina. We have got one more type that we call Prinzmetal type of angina, that is rest phase angina. It means that this type of pain can occur also in the rest. Patient is not doing physically anything, but he can get pain, he can get anginal pain in the chest. So this is because of, most of the time, that coronary artery is blocked. So coronary artery is blocked with plaque, with something cholesterol type of stuff, with fat, atheroma. So it's a sort of atherosclerosis condition, that blood vessel has got some plaque of fat, and that blocks, that hinders blood supply to the heart muscle. Then there is one more condition in which we can get this type of angina, that it don't have to do always with atheroma. It can be because of the cramp also, that there is a sort of cramp in the coronary blood vessels, and because of the cramp, the blood supply is not enough. Then patient gets also pain in the chest. So in this case, either it is blockage, or because of the cramp there is blockage. So then if we know the reason, then we can treat that also. To treat this angina, we have got two options. Option number one, that we should have good blood supply to the heart muscle. We should increase that supply one way or other. And second option is to minimize the demand of oxygen to the heart. And that we do with minimizing the workload. That we will advise our patient not to do physically much. Then he won't be needing more oxygen. Then in another type of angina, what comes in the rest phase, that without doing much, patient is getting pain. So in that case, we have to remove that plaque. We have to remove that atheroma, that atherosclerosis type of condition of the blood vessels, of the artery, of the coronary artery in special, so that blood supply to the heart gets normalized. And the second type of treatment is to take care of that coronary artery doesn't get cramps. So therefore we have got a few medicines that relax our blood vessels. And at the same time you have to work to make that blood flow better, so that the heart gets its oxygenated nutritional blood supply regularly, and according to the demand, how much our body needs, he should be able to give that. So in modern medicines, you have got few medicines that work instantly. They are nitrates, short-acting, long-acting nitrates. Short-acting nitrates are just sublingual, and orally is being given long-acting nitrates. These nitrates, they convert into the nitric oxide, and nitric oxide is vasodilator. So that means that blood vessel is then dilated, so that blood goes easily to the heart muscle itself. We have just discussed that how cramp can give you this angina pectoris. So cramps are because of the calcium influx in the cell more than it's needed. So if there is more influx of calcium in the cell, it can give cramp. So we have to then stop calcium inflow in the cell. So that calcium channels are being blocked with medicine like amlodipine, verapamil, and ditiazem, and these are all calcium channel blockers. Then you have got also medicine, sodium channel blockers, because we see when sodium is more in the cell, it's going to increase the heart rate, and by that way, more oxygen is required for the heart to perform. So they block then sodium channels. Sodium channel blockers are being used. Then very famous medicine they have got, that is beta blocker. So beta blockers, they block sympathetic overflow from central nervous system to the blood vessels. So that way body is getting relaxed. So that hyper functioning of the heart is getting slowed down. So that way is less oxygen required to perform. So these are the measure what is being taken. But in Ayurveda, we have got very clear vision how our mind works on the blood vessels so that it doesn't get cramps. So we have to give something to take care of that atheroma, that sclerosis type of. So we give googles in that. Googles take care of that unnecessary plaque or fat type of tumor, atheroma. So whatsoever is blocking the blood flow to reach the heart. So we give Haridwala, that is very good medicine made of Arjuna, and that helps to rejuvenate the heart muscle itself. Because heart was not getting oxygenated blood with all the nutrition, then the heart got weak. So we have to strengthen that heart on the very first place. So therefore we have got Harid Bala. So Harid Bala is to take care of that muscle, to rejuvenate that muscle. Heart is a muscle itself. So that way it can function again properly. So in Ayurveda we take care of angina pectoris by giving few herbs for central nervous system. So we give herbs to take care of that blood vessels, that it should not be having cramps, it should be relaxed. So we give few herbs to take care of that atheroma, that arteriosclerosis type of condition. And not to forget, lifestyles play an important role. Slowly, gradually, you will feel better if you lose your body weight, if you take care of your food, if you take care of your conditioning. Every day you should make long walks, but don't force. If you are having pain, just stop, but increase little by little. So that way you can overwin this condition of angina pectoris. So it's a life-threatening disease. You must take care of yourself. You must follow the advices of your GP, general practitioner, medicine given by your heart specialist or your general practitioner. You must follow that. Besides that, you can do what I have advised, that taking care of your physical movement and diet, of course, mindset, meditation, lifestyles play very, very important role. So I hope that I could make my point clear herein. Thank you very much.